My role within Graphnet is Director of Analytics, and specifically what I do is I work with integrated care systems to implement population health solutions and try and bring those analytical use cases to life. But I want to touch on firstly on cohorts and how we give you, I suppose, that ability within the platform to understanding the population, because if you don't understand your cohorts, which is quite a fundamental element of being able to look at, the size of cohorts, then you can't also, identify, monitor and evaluate the other parts. Loads and loads of different types of events that occur across an ICS in health and care, and they're all coded. We know how much codes and data points there are within the NHS, but what we try to do within population health within the Graphnet platform is to normalise that and make it much easier, because that then gives us the ability to really do some clever configuring part of any population health programme, any type of intervention, modelling or evaluating, and the monitoring really is to have really contemporaneous data which you can then use to figure out if something is working or failing. So we do auto matching of patients to cohorts on a really regular basis, at least weekly as well. And then what we do is give you the ability to surface those cohorts of patients, all that information in a user interface tool at the end. In terms of building cohorts, just to give you some really markers in terms of some of the key parts. So, the flagging, automated flagging of vulnerable groups of patients, are they known to social care? Are they carers? Long-term conditions, so automatically things like quality outcome framework cohorts are built within the platform, but there's also the option to build user-defined cohorts as well, and you can also do it on the fly in certain tools as well. So if you want to do your cohort that you're interested in looking at, we build complex searches as well, because you may want to be looking at particular patients and excluding others, so that capability is also built into the platform. And health equity markers such as those demographic influences, age, ethnicity, gender deprivation. Resources were also really important. How do we understand how if we're going to transform within the NHS, we need to understand the picture of what's happening at the moment, because often when you're looking at the financial analysis and whether it's cost effectiveness, is the impact of transformation benefiting other parts of the service that you're perhaps trying to resolve as well, impacts on workforce, risk stratification too, and also place-based analysis. So if you think about all of those different data points that come together, they give you a really large part of information in which you can then use to gain that insight and look at the impact.